Wisconsin Democrats have been trying to convince Republicans for years to expand the state's Medicaid program, known as Badger Care. The expansion would cover about another 90,000 adults who currently are expected to get their insurance off the federal exchange. Democrats have no idea how many of those 90,000 people are even interested in Badger Care. Do you think all 90,000 would sign up for Badger Care if you were able to get it expanded?
I think a lot more than currently do the subsidies on the exchange. And I'm pretty confident that we would get a much higher amount, as we've heard from advocates repeatedly and as we've seen in other states. That's part of the reason their health premiums are lower.
Everyone who makes up to 130% of poverty would qualify for Badger Care under the expansion. But right now, everyone who makes up to 150% can get private insurance for free on the federal exchange, thanks to new subsidies from ARPA.
So folks, the real problem isn't access to health insurance. The problem is that we won't put people on a government welfare program to do it.
And why would anyone want government health insurance when they can get free private health insurance?
The enrollment is more complicated. I mean, one of the benefits of Badger Care is that it is simple, it's affordable, and that's why we really stress the accessible word.
What it really boils down to is money. The federal government will give Wisconsin about $1.6 billion over the next 2 years if it agrees to the expansion, and that money can be spent on anything. Democrats are salivating over that potential slush fund and spending it right before a big election year.
But can you imagine not taking $1.6 billion? The projects the governor has identified, which have been community projects throughout the state, they will not happen. They will not receive funding. It's not just about recovery, it's about opportunity.
Governor Evers wants to buy everything from community centers to stewardship land, to visitor centers, to housing projects, to cultural centers, to research grants, to community clinics. Republicans say this kind of spending has gotten completely out of control, and someone is eventually going to have to pay for it.
I just am afraid, and I think there's a harsh reality. This high that we are living on right now, we're going to come off of it, and the hangover and the headache is going to be tremendous. Because when inflation comes and gas is more and your food products are more, and again, we're in the hangover mode because the high's gone, we're going to be left dealing with this, and it's going to be those most vulnerable who are going to be impacted the most.
Republicans are sticking to their guns about not expanding Medicaid, and they better be able to articulate why throughout the campaign cycle as Democrats lament the giveaways that could have been. For the McIver Institute, I'm Bill Osmolsky.